Okay, so there we go. All right, so welcome everyone. Hi, I'm Susan Blum, and you're all here to have a conversation with me and to ask questions about, and to hear my answers about arthritis, about inflammation, and then any other things that, might be top of mind. It is now, it's an interesting time that we're in. This is a time of the coronavirus pandemic, and we're in what we hope is our last surge. And interestingly, this time I did this talk last year, and I've done intermittent. Oh my God, you guys all know because you've been here getting my recordings. I've done a lot of office hours and a lot of talks and a lot of conversations. And those were really the main questions for the past 2 years. Even if I was doing inflammation or arthritis or autoimmunity or something else, COVID was on top of everyone's mind. And I will give you a lot of credit that today you all sent in questions. I have 50 or 60 questions and no one asked about COVID. And so maybe either emotionally we've moved on, or mentally we're ready to move on, or we really are moving on. And it does sort of feel like we are hopefully coming out of this thing. So I'm not going to spend any more time on that because that's not what's top of mind. We're talking today about inflammation. And isn't it nice to be able to focus again on ourselves and our health concerns and all the things that we need to be in order to prevent and treat chronic disease going forward. What the pandemic has done, I think, for all of us is really focused, especially in the healthcare field. And I think for everyone, just in their whole search for what's the best way to prevent it, talking about risk factors, what are the risk factors to getting very sick, all of that. The reality is that a lot of the things that I've been talking about for years and years, and I've been writing about, and I help try to answer questions about, all have to do with the underlying triggers of inflammation. And a lot of these things that put you at increased risk for more severe COVID are a lot of these foundational triggers of inflammation, which come back to a lot of food, the stress system and how it affects the microbiome and the gut microbiome. There's really interesting look now at how the gut microbiome affects outcomes in COVID. And so there's just, anything that damages the immune system or makes it hard to function or damages its ability to function optimally is going to make it harder for your immune system to fight off something that it needs to fight. And so the work that I've been doing all these years, and what we're here to talk about when we say, like, how do we reduce inflammation? It's the same conversation in a way about, how do I improve the functioning of my immune system? The immune system is part of the whole cascade towards inflammation. It's a player in the inflammatory process. And so a lot of these things that we talk about, have a role in just your overall prevention and wellness strategies. It's critical. And so lifestyle medicine, which is the foundation of, how you live, right? So it's about living a low toxin load life, living a life that's low in toxin exposure, and living a life full of antioxidants, and living a life that balances your stress system so you're not walking around in a hypervigilant, high turned on stress state all the time. And all of these things are going to be really important for not only preventing chronic disease, for treating your arthritis, but it's also for how to have a well-functioning, rejuvenated immune system. A lot of these things that we're working on doing. And so it's about a balanced immune system that works properly. Where we sort of enter in today from an arthritis, because we're talking about arthritis today, what I just said is all, the way I just sort of proposed that whole concept is general, right? Those are the general terms, the general way to think about, the foundational. I think about the functional foundations of the body, like why they're so important to keep them tuned up and working well, right? Because it'll help your immunity, it'll help your inflammation. And then there's all the research and what we know about arthritis and specific strategies in that realm within lifestyle medicine. Like what is it about food specifically, like targeting, like what are the targeted strategies we can use within that whole world, which is food and supplements and microbiome and toxins, and how does that all, what's the research we know that connects it to arthritis? And actually that's why I wrote my second book, which is Healing Arthritis, which I know a lot of you have read and a lot of you have it open in front of you. A lot of your questions you sent in was, I'm in the middle of reading the book and, here I'm getting stuck. And so I think it's really important to really, for me to also help sort of hone it in for not just these general lifestyle sort of ideas, but really what do we know and what does the research tell us, and what do I know in my practice of 20 years of practicing integrative functional medicine, what do I know really does work? And so that's what I'm going to try to answer your questions. I'm going to give you that information while I answer the questions. And so a couple of points now before I jump into questions about how we're going to work our session today. Let's see. So we're on Zoom and it's Zoom webinar. So you can't sort of, there's no pictures of you, there's no hands. I don't do the hand raising, so don't raise your hand, sorry. But what you can do is, I hope later, I'm going to start with the questions that people sent in. I'm going to work my way through it. And I will go and look later. If we have time at the end, I'll scroll down through your anything you post here. And so, what I want to say though about the questions is very interesting, all the questions that everybody sent me. They really all fall into general categories. So please have a lot of patience as I answer the questions that came in, because trust me, like let me see, there's 16 questions about food. And I'm going to start answering the questions about food. And while I answer the questions about food, you're going to see I'm going to end up answering your question about food as I answer everybody else's. At least I hope so. So if you have any questions about food as you're sitting here, please don't post them right now. Wait till I finish answering all the questions about food. So what I would say is the questions that came in fell into these sort of groupings. A lot of food. That was probably the biggest category. A lot of questions about just inflammation in general, like what's the best way to reduce inflammation, or kind of thing. But I put it into a category of like general inflammation. There were only a couple of gut questions, which I thought interesting. Some questions about like what do I do about injury? So injury questions, a few questions about labs, like here are my labs. Some people asked me some personal, like, here's my story, what should I do? And I just want to start out right now by saying, I'm probably not going to be able to answer you directly about what you should do, because, otherwise there's just no time for that. This is not a medical consult. This is going to be general, I'm generalizing these questions to everybody. There's some questions about medication, some very specific questions about osteoarthritis, a lot of questions about pain. I think that was my next big category. 1, 2, 3, 4, 5, 6, 7, 8, 9 questions about pain and what to do about pain. And then there was some personal questions, and then a bunch of RA questions, rheumatoid arthritis. I sort of lumped psoriatic arthritis in with that. And then a whole bunch of questions about supplements. So I'm going to start with food. One of the things though, before I actually jump into that I just realized I want to say before we get started, because there were some questions about diagnosis, not being sure what's wrong with me, what kind of arthritis do I have. Whether you're here to ask questions about inflammation or you actually have arthritis questions, one of the most foundational pieces to remember about arthritis is that no matter what kind of arthritis you have, whether it's rheumatoid, psoriatic, spondyloarthritis, those are the inflammatory arthritis conditions. No matter or you have osteoarthritis, which is thought to be like wear and tear in the joint, damage to the joint capsule from wear and tear or the joint. And not called inflammatory arthritis, it's its own category, osteoarthritis, and thought to be inevitable wear and tear. What I'm here to tell you is no matter what kind of arthritis you have, no matter, which joint it's in, where it is in your body, if you have inflammation in your body that's being triggered from somewhere else, so it could be from the food you're eating, from a really, worn out stress system or a problem in your stress system, which I'll explain, which we'll have the opportunity to talk about. But the food you're eating, chronic trauma, stress, long-term issues, or not so much issues, but ongoing, long-term, recurrent, or past trauma, stress. Those things, gut microbiome, toxin load, and infections as well. All of these things can just drive inflammation. It's like the whole sea rises in your body, and it's going to make the inflammation in your joints worse. And so in addition to, as we go through the questions, you're going to see it's really not just about, so yes, what should I do about my pain? And so some of my answers are not, and some of you asked about injections. Should I get cortisone shots? Should I get, and so a lot of the way that I approach this is about finding and reducing all the sources of inflammation in your body and balancing all your functional foundations so that your immune system and inflammation levels go down. And then your joints feel better. They're less inflamed and you have less pain. This is what I have found to work in 20 years of practice. And there's a lot of research. My book, the Healing Arthritis book, has tons of research, articles, quoted. So there's research and articles to back up why these strategies work. In the integrative medicine world, sometimes we do use herbs and supplements, like herbal pain meds, integrative combinations of formulas, supplements. And so I'm not against that at all. And you'll see I do use supplements. And there's actually some really targeted integrative treatments that can help you, like trigger point injection. Like there's sometimes injections in the regenerative medicine world. I'm okay with those things. But in addition to, like me just giving you an herbal Advil, right, for the pain, sometimes I do things like that, and we layer that in, because who wants you to suffer with pain? I don't want you to have pain, but that's not a strategy that works all by itself. So while as an integrative practitioner, I do have little tricks up my sleeve for helping with pain, or helping, directly giving you like the integrative version of a pill to help you feel better. That doesn't substitute for our need to really go down to the drivers of the inflammation. So that's really what I wanted to point out. And so for all of you listening, no matter where your inflammation is, no matter where your pain is, no matter how, and this is true for muscle pain, this is true for fibromyalgia, this is true for tendons and ligaments, this is true for wherever you're having pain and inflammation. All of the things we're going to talk about today, and you'll see because the questions take us there. And as I answer them, it's really about how do you reduce inflammation in the body, and then you'll feel better. At the end, because I sorted my questions alphabetically, supplements went last. And so there were questions about the supplements that we use. And I'm happy to share those with you. And in fact, I can share my screen and I can show you things and explain to you why we choose them. They are companions, and they actually work at a deep level. A lot of my supplements are to work at a deep level to repair the foundations of the inflammation, and not just a pill. Okay. All right. So let's get started. And again, beware about sending me really personal questions. You understand why I can't really, I won't have time to dig into them for each of you, but I'm going to do my best. What's going to come next, and I will say this at the end, I'm going to explain this, I'm very excited about it, is, I do an online program with Melissa. Melissa does the lion's share of the work, but I'm with her. But the coaching calls every week, and we're really rolled up sleeves helping you through the program. It's really bringing the book to life. And so it's an online program that we do the book, and we do the book together. And so all of those questions get answered in that forum for sure. So if you have a lot of personal questions and you need someone to really help guide you, our online group program is fantastic because everything is personalized. You get your personal questions answered there. It's very individualized. At the same time, it's a group. Okay, so let's jump in and start. So food, okay? Every one of my books, the first section is always about using food as medicine. Food is absolutely the most important, single most first thing you need to do. And a lot of you have written in that you started with the food plan, you did an elimination diet, and you don't know why, and it helped a little bit, but where do I go from here, right? And so in terms of food plays a role in these ways. It's more than, it's not as simple as you think. So the food itself can be inflammatory, pro-inflammatory, or anti-inflammatory. And that's as simple as the colors and polyphenols and antioxidants in the foods and the vegetables and plants that you're eating are straight, like antioxidants are anti-inflammatory. Like you have to just decide that like there's no line that divides those two. Not enough antioxidants causes something called oxidative stress, which is too many free radicals running around damaging your joints. And so they're just like sparks in the body, and the body always has sparks. Sparks are generated from your cell function and your mitochondria every day, and every second, every night. Like it's explosive. Like you can't even quantify how your mitochondria, which are the little furnace in every cell, are working for you all the time, every nanosecond. And they're always making sparks. And if the sparks get out of hand, it creates inflammation. How do you put out the sparks? Antioxidants, because the sparks are pro-oxidative. So you need antioxidants. Nature gave them to us. A lot of really good studies about arthritis, and especially in osteoarthritis, the increased oxidative stress inside the joint capsule. It's true for rheumatoid arthritis too, but that's sort of obvious. We know it's an inflammatory arthritis, but osteoarthritis, they found, studies have found high levels of oxidative stress. And so you need antioxidants. And so what does food do? Food gives you good stuff. So the first thing it does is it gives you the good stuff. So it's not just what to take away. We always talk about therapeutic food plans. And by the way, don't get me started about therapeutic food plans. I use them all the time. They're not meant to be forever. And some of you ask questions about that too, like, do I have to do this forever? How long? When I add food back, I still don't feel good. I still can't add food back. And so the way I look at food and food plans, therapeutic food plans, is it's temporary. You're removing some foods, but you're making sure to put in all the good stuff, which is what I started by saying about antioxidants. But therapeutic food plans are, even my plan, which I use for arthritis, I call it the Leaky Gut Diet for Arthritis. And if you hear sort of the title of it, it's a leaky gut diet because the gut microbiome and a leaky gut is part of the problem here. And so by going on a therapeutic food plan, which is removing a lot of foods, it's these elimination diets that everybody hates. But by removing all those foods, you sort of calm things down because they're triggering inflammation in the body because you have a leaky gut, which means that the intestinal lining is not a firm barrier like it should be. Instead, it's a little leaky. And so when you eat food and you digest it, the proteins of the food slip inside the body and trigger inflammation by the immune system right below the surface of the gut. And so the leaky gut is the problem here. We think the food's the culprit, but it turns out that that the leaky gut's really the problem, why we have systemic inflammation from food. And so when we talk about food, when you're removing food and doing these therapeutic food plans, my goal is always to remove the food and then heal the gut. So you have to remove the food, heal the gut, heal the leaky gut. And that's when you're finally able to return and reintroduce food again. For people who have eliminated food and haven't felt better from it, there are a few questions on that. I've removed the food and a whole sort of explanation of all that you've done. And you feel a little bit better, but you're stuck. It's like you've hit a wall and you're not getting even better. You're not making more progress. Well, you have to work on the gut microbiome. You have to repair, you have to treat the bacteria, improve the bacteria in the gut. We'll get to talk more about that when we talk about gut. You have to repair the gut. You have to get rid of the weeds in the garden, as I say. You have to clean out the weeds, improve the flowers, get the microbiome healthy, heal the leaky gut. and then you can reintroduce the food. And unfortunately, especially for those of you with rheumatoid arthritis or psoriatic or spondyloarthritises, which are the inflammatory arthritis group of arthritis conditions, and some of you with osteoarthritis who just have a really bad gut, that can take a long time. It can take up to like 2 years in rheumatoid arthritis people. And so this isn't something for some of you it might take some time. And in our experience, and we've been leading it's been like 8 years, I've been leading the groups. My first book came out, it's a long time since my first book came out. Arthritis was published in 2017. So the online groups was since 2017. So this will be our 4th or 5th year leading the arthritis online. And, what we've learned to help people with is, okay, we do our first round of everything, we treat the gut. Okay, maybe we're going to have to treat the gut again, and I tell people you're probably going to have to work on your gut for a year or two till you really get out the other side of this thing. And so I think that's the first point I want to make about food, is that it's not so simple as, 1 month elimination diet, and then I can get the food back and I'm done. Unfortunately, if you're here on this call and you have arthritis, you probably have a lot of inflammation coming out of your gut via this whole leaky gut piece. And the foods that you determine are triggers for you will probably need to stay out for a little while longer than you wish. And you probably won't be able to add them back until we do the gut work, which is really what the book takes you through. And I understand that's why I wrote the book, so that people that are on limited means don't need, can do it yourself without coming to see us in the office. If you can't come to the office, do the program in the book. It's very step by step. And we also have the online program with coaching, which really we took the supplements out so that we could just make it a simple coaching only to make it affordable. And then the supplements will just be optional for people to add on if they'd like to. So I'm going to do the food questions now. Number 1, as I have Hashimoto's as well as arthritis, does the food list for arthritis pain apply to folks with Hashimoto's as well? Love that question. So basically, I have autoimmunity. And is this a good autoimmune? Like, I have arthritis and I'm autoimmune. And I bet a lot of you out there that are watching this also have Hashimoto's or another autoimmune condition, because Hashimoto's is so common. And the answer is absolutely yes. Leaky gut is associated with all autoimmunity. And if you have an autoimmune condition, including Hashimoto's, I strongly recommend the elimination diet, as well as repairing your gut, just like we're doing with everybody here in the arthritis program. So yes, the arthritis program that you're going to follow will help your Hashimoto's. Now, what about grains, or is just quinoa okay? And so this brings me to how strict, this whole idea that a lot of people always ask about, what about lectins, and what about night? Well, I do take nightshades out for the arthritis program, because nightshades, tomato, potato, eggplant, peppers, have been shown to have high irritating compounds in them for a lot of people that cause, sort of flare arthritis for them. Somehow tomatoes seem to be the worst offenders, but people have all sorts of offenders. So I do take nightshades out. Depending on how severe your illness is and how damaged your gut is, I always start people on the basic elimination diet, meaning gluten, dairy, soy, corn, eggs, and nightshades, and sort of sugar, and processed food and all that. And that's the leaky gut diet for arthritis. I don't think everybody needs to do the no lectin, no grains, no nuts and seeds, like the autoimmune paleo program. There are a lot of therapeutic food plans out there that really pull everything out, including grains and including nuts and seeds and including legumes. And so some people might end up needing to be more restrictive. But I feel that in my experience, there are some people that end up needing that, and we coach, and that's what we do with the coaching. So I still believe in starting with the simpler food plan and seeing if that gets us where we need to go. If you have a lot of gut issues and so what does that mean? You've had lifelong IBSD, you've had IBS kind of stuff, gas and bloating after you eat, constipation, diarrhea, abdominal pain, reflux. What else am I missing? Noisy, gassy, gurgly tummy after you eat, heartburn. There's all sorts of, if you're a gut person, and you also know how bad it is. And if you also have really severe rheumatoid arthritis, for some of you, we might, after doing the initial food plan, if you're not feeling relief with the, and especially digestive relief in your gut, then we might recommend being a little more restrictive on the grains. Otherwise, we, for the overwhelming majority of you, and actually for all of you, I always start here. And then we just get a little more restrictive if we need to be. So I hope that answers the question. Quinoa is great, and gluten-free grains are great. But again, if you have a very damaged gut, and which we can help you decide if you are, but like I already told you, the tip-off is severe inflammatory arthritis, like on a lot of meds, severe leaky gut, a lot of gut symptoms, we might recommend you being a little more restrictive in your food. Therapeutically at the beginning, okay? And again, my goal, I work really, really hard with everyone to help them get back to being able to eat food again and reintroduce it. And that has to be the mentality. That's the goal. Fix your gut and you can eat a lot of these foods again. There might be food that you will find lifelong is something you generally don't eat. And I'll use myself as an example. So I'm gluten and dairy free. So at this point, I'm 95%. So I was trying to get to what I really don't eat. So I don't eat gluten, dairy. I really don't eat much soy. It doesn't really agree with my gut. I get a little reflux from it. I don't eat much. I just don't have it in the house. So gluten, dairy, soy, corn, I eat like an egg a week. I find that I have to be very limited. I'm limited on these things because if I start eating them a lot again, I'll get digestive symptoms back. And my autoimmunity, I don't have arthritis. I had a little bit of arthritis that was starting a few years ago. That's gone. My Hashimoto's is gone. And for myself, at home, there's no gluten, dairy in my house. There's no gluten and dairy in my house. My husband's a vegan, so we have soy in the house. He eats soy more than I do. I'll eat it occasionally. For me, like I said, we generally don't have much corn in the house. I just don't use it much. And eggs, like I said, he's vegan, so he's not really eating eggs. And I just eat them on occasion. So I've come here after doing this for 20 years. Because those foods generally don't agree with me. But now, I'll go out to a restaurant and I'll have a salad with goat cheese in it. I'm like, woohoo, I'm having goat cheese, and I definitely do that. And if I do that once a week, I can go out and not worry too much about what I eat, and I will not get symptoms again. But that's sort of the goal. You want to get yourself to a place where you can eat those foods on occasion, but some of these foods might not be your friend ever, to eat them every day in, day out, like you might have been doing before. So I use myself as an example. I hope that was helpful. I'm very interested in how dietary choices impact pain, from joint pain to heartburn. So I said a little bit about that. If you can address that with specifics, it'll be appreciated. So I think I sort of said that, so dietary choices impact pain. So pain by itself, actually, this is a really interesting thing that I didn't mention before. I actually really like this. And I learned this when I was doing the research for my arthritis book. There's actually there's pain receptors in your joints for acid alkaline. So another way to think about food choices and ideas for what you should eat and how you should eat is about eating alkaline, we call it. And so it's eating foods that generate alkaline in the body as opposed to generating acid. And so acid producing foods are all the animals, right? A lot of animal food, dairy, animal protein, all protein has amino acids. And all this means is when you eat the food, your body metabolizes it, and does it generate acid or does it generate more base, alkaline? And so you want your blood to be a sort of very tight pH, but you can end up in a little metabolic acidosis, that's called, If you end up eating overwhelmingly acid-producing foods, overwhelmingly animal, and not enough alkaline foods to balance it, and really the right balance is like 70% alkaline and 30%. Doesn't mean you can't eat animal, but there's a balance. And there are some interesting studies about alkaline and acid, in that there's acid receptors, they're pain acid receptors in your joints, and they're triggered by a subtle change in your pH. And so if you eat, so this is where food comes in, a more alkaline based food plan, a food plan that promotes alkalinity in the body, which it turns out is the best food plan for osteoporosis, by the way, because too much acid is going to subtly cause a very subclinical metabolic acidosis, which causes not only the pain receptors to get triggered, but it will cause you to pee out calcium, to have your kidneys start peeing out calcium to buffer the acid in your urine. And so an alkaline diet is just good for so many reasons, and that's really good for pain. The other piece to the pain piece, which goes along with the alkaline food plan, is really about, there's what I was saying before about oxidative stress. So the first step in this whole pathway, this whole like process that ends up leading to inflammation and pain, are these free radicals being generated in the joints, and this is oxidative stress. And so eating enough antioxidants is this is a very specific food approach. And how diet, when you say, how does diet choice impact pain? So it impacts pain from metabolic acidosis. It impacts pain from promoting oxidative stress or not helping treat oxidative stress. So you need to eat a lot of colors. It's the rainbow. Antioxidants, it's in every color. It's all fruits and vegetables. Now, I had this running debate, and she's listening, so she's going to laugh, but we had a running debate in my office, I think it was today even, about legumes as a source of protein as opposed to, chicken, because legumes are carby. Some people think legumes are carby. But the thing about legumes is that they have tons of, like lentils have polyphenols in them. They have antioxidants. They have fiber. Fiber pulls toxins out of the body. There's all these like beneficial aspects to it, and they are not as acid producing as animal food is. So on these acid alkaline charts, lentils are actually very much closer towards alkaline as a food as beef and lamb and chicken and poultry and red meat and shellfish. Actually, fish isn't too bad. Fish is actually a little more alkaline. Shellfish is a lot more acid. And so there are these tables where you can look at acid alkaline, qualities of different food. But as a generality, all the plants are alkaline. Plants are very alkaline, and animal is not. So, so oxidative stress. So how do you reduce pain with food? It's antioxidants, oxidative stress. It's alkaline eating, and then last but not least is about the kind of fats you're eating. And this is why we use a lot of fish oil as supplements. There's something called the prostaglandin pathways in the body. It's just a kind of intermediary, an inflammatory compound that's like, we call them intermediary. It's a go-between. Okay, so they're called prostaglandins, and prostaglandins are influencers. They influence whether you'll have anti-inflammatory pathways will be activated. They also are pain influencers. Okay, they're part of pain pathways. And so the kind of fat you eat determines the kind of prostaglandins you're going to have in your body. And so omega-3s, which are fish oil, omega-3 fats promote the best prostaglandins. Animal food, animal fats, so saturated fat that you find in egg yolks, and animal food are all promote prostaglandins that are inflammatory and not good. And so helping you shift to a healthier fat. So one of the things we do then in the food plan, in our approach, is to increase the consumption of nuts and seeds, right? And increase the consumption of, and give you fish oil, increase the consumption of fish over other animal, fish is an animal, I guess. And so taking out saturated fat and increasing polyunsaturated fats, PUFAs, polyunsaturated fatty acids, tons of olive oil. More and more studies come out every day about olive oil. I tell people to drown themselves in olive oil. I don't think you can eat too much of it. Like olive oil should be what you use for everything. I'm not great about coconut. Coconut for me has actually caused so much high cholesterol and plaque. Like I'm worried about coconut for my cardiovascular people. And after menopause, heart disease is the number of killer women. And really, menopause, that's a big chunk of the people in our practice is that come to see functional people and probably that are here on this call, or, you're in that 40 to 60 range is probably where you're at. And some higher, some lower, that's fine. But my concern about coconut is about cholesterol, and I worry about heart disease in women, and especially there are studies that have correlated rheumatoid arthritis. People with RA, women with RA are at increased risk for heart disease. So be careful about coconut. I think avocado is fine. It's got it doesn't have just pure saturated fat like coconut does. Okay. So let's see. Should one avoid all nightshade produce? Yes. And I told you already, it's a therapeutic food plan. It's not forever. Can collagen help with joint pain? If so, what kind of collagen is best? So there's different kinds of collagen for different things. There are some studies that have looked at for rheumatoid arthritis people that type 2 collagen does something for the whole autoimmune process, which is a different mechanism that collagen as just a nutritional supplement to give you more collagen to rebuild your joints, if you think that's what's happening. I'm not really sure whether collagen really is going to help you in anyone rebuilding their joints. The type 2 collagen studies are really interesting on the rheumatoid arthritis people, and I used to include that in our original arthritis protocol that some of you might be familiar with. The problem, it's just expensive. I tried to sort of hone down and only really do the things that had the best studies in it, but type 2 collagen is sort of interesting. And so there are some products that have that. Oh gosh, I'm forgetting what the product was we used to use, but we can get that information. But it's called type 2 collagen. So, but like as a broad kind of making sure you have enough protein and making sure you have the right amino acids for your muscles and joints, I think collagen, I'm fine with supplementing with collagen. It's a very important structural protein for the body. And I think overall it's I usually just tell people to do like whole body collagen protein powder. Designs for Health makes a good one. There's a lot of collagen like that people stick in there, the vital nutrient, what's it called? Vital proteins, they stick it in their coffee. That's all fine. You don't, but again, I don't believe in overdoing any one thing. So use that, you don't use that, it's fine. How much concern should we have about oxalates, salicylates, and other poisonous acid from foods in the diet? So I like this question, and I think it's a good one for everybody here because it reminds me about lectins. Food has all these things in it. And I think in all the years of my practice, I'm 20 years now, and thousands of people I've treated, I've had one that's had a problem with salicylates. And we had to try to help her go on a low salicylate diet. Nature gave us food that has a lot of oxalates in it. The problem isn't the food, the problem is us. And we have bacteria in our gut called oxalobacter. One of strain is called oxalobacter. I think it's oxalobacter, but it chews up oxalates. Your microbiome is supposed to chew all that stuff up for you. It's one of the reasons we're symbiotic and we're good friends. And so it's supposed to chew that up. And if it's not chewing it up, then the problem is in your microbiome and it's not with the oxalates. And it's actually really interesting. Wait 1 second. I just got to get the heat off over here. The heat turned on. Okay. It's really interesting. Like I follow urine oxalate levels because it's part of one of the tests I do regularly with everybody, the urine test that I use for my just general health check. And it's called the metabolomics. And it's really interesting. The urine oxalate, sometimes it's really high when I first do the very first test with somebody. we do a lot of treating of the gut microbiome, and all of a sudden the oxalates are normal. So I really believe, and I also have kidney stones, which I haven't had a problem in a really long time. I really feel what ultimately fixed my kidney stones is, there we go, an alkaline diet again. You're going to learn all about alkaline, like all the reasons to have an alkaline diet, because you don't want to pee out calcium, right? Kidney stones, alkaline diet, so that your urine pH is good and you're not peeing out calcium, because calcium makes stones in your urine. And I didn't need to go on a low oxalate diet. Instead, I did a lot of I just worked on my microbiome, and I'm good. So you want to have the right bacteria to chew up the oxalates. So again, we're back to the gut. And if your gut is good and your microbiome is healthy and strong, oxalates, salicylates, poisonous acids from food. I hate the way that sounds. I don't like us to be afraid of food. We shouldn't be afraid of food. We need to help our body heal so we could tolerate food. Now, the food is different. I will say, like commodity food, mass-produced food, there's lead in our soil. I mean, there's all sorts of stuff in our soil. There's pesticides, herbicides. Food brings in some problematic things. But if it's grown organic, organic food grown in a, in good soil, we should be able to eat them. And that's just my position. And you might not be able to eat them at first. Again, same as lectins. So I agree and then I disagree with my colleagues, right? Like the Gundry people, like I don't believe in never. I believe I just believe that we can help our body heal, and then we can eat those foods again. So it might be that if your gut is really bad, you might need to limit some of those foods for now. And a great dietitian like we have at Blum Center can help you do that. But eventually you should be okay. Another question that was about, like, I did food by myself. I tried cutting out sugar. I did gluten-free, but I'm still not getting what am I missing? What am I missing? And for those, you might recognize that this is you asked about your husband, but you haven't done any gut work yet. So you do food and you see how far that gets you. You remove food and you clean up your diet. So important. And everyone gets a certain distance with that. But if that's all you've done, you now need to move on to step 2. If a vegan diet helped relieve all symptoms, but they come back after other foods reintroduced, including red meat, is it possible to have meat in diet again long term? I think I answered that question. I hope so. Interesting thing about meat is that be careful about where you're getting your meat from, because meat, beef, cows, they're fed corn and they're fed soy. So if you find that you have a soy or a corn sensitivity, you might actually, and they have hormones and they have, antibiotics, and they have all sorts of bad sort of toxins that come along with them, or proteins or compounds from what they were fed and what they were given that translate and come into you. Who knows why you're reacting to red meat? It could be the kind of red meat as opposed to red meat itself. So try, if you might, when you reintroduce it, grass-fed organic beef, and really be careful. Grass-fed and finished, you want to make sure that they weren't given corn or soy if you find you're sensitive to those things. So I don't know if it's the beef, but sometimes you just have to wait longer and give yourself a chance to heal more completely. And then you might still find you don't like how you feel when you eat it, and that might change you lifelong. We're pesca vegan in our house, and I wouldn't at all feel good eating red meat, because I just know it would sit and I couldn't digest. I just wouldn't feel good eating it, and I don't know that that'll ever change. And so there could be like a shift that happens within us where certain foods, we just don't enjoy them the way that we did before. When you change your diet, how long does it take the body to really incorporate good cellular changes? Oh gosh, I always say, I don't know. I think 3 months is a good time to really see a change. Depending on what it is that you're healing, like how far, depending on how far in the hole you are, what your deficit is you're starting with to get to your goals. I don't know how long it'll take, but I think a good 3 months is a good time. Most cells in your body turn over in 90 days. So that's a good sort of general strategy. Do you suggest a strict vegetarian vegan diet for RA? I think I sort of, talked about that already. I don't. Just because I am doesn't mean everybody has to be. I'm like 70% alkaline, which is plants, and 30% if you want to do other things. But I do believe that the 70% of the food should all be more plant forward. Is lactose-free dairy problematic? Absolutely, yes. Cheese, the problem that's in food, dairy has three components: lactose, casein, and whey. Casein and whey are the proteins. The lactose is the sugar. Just taking out the sugar, and cheese is generally low in lactose because it's mostly protein. It's the casein and whey that are often the problem for people in stimulating inflammation in the body. Lactose will often be the digestive issue. And sometimes whey and casein also, actually, but yeah, if you're going dairy free, lactose free is not the same thing because you have to eliminate the casein and the whey. Why does sugar cause so much inflammation, and do substitutes? So sugar, yes, sugar. When you eat sugar, your blood sugar soars up. It stimulates a release of insulin, and it triggers actual inflammatory compound release of inflammatory. It actually triggers your immune system. It pokes your immune system, and your immune system releases inflammatory compounds, directly stimulating on your immune system blood sugar levels. So it's very interesting kind of stuff. Monk fruit sugar and stevia are good replacement. So monk fruit is not as triggering. So a lot of that's being used in a lot of protein shakes now and protein powders. And so that I think is probably a very good low sugar fruit to have. Stevia, for people wanting to lose weight, I'm concerned about too much stevia in that, we're not really sure if stevia still triggers the brain to think you're eating sugar. And so the body still has a reaction to stevia that has a little bit of problematic aspects to it. So I think you have to be a little bit careful. When you have something sweet, you feel it in your joints. Yeah, it's an inflammatory thing. What I would say, if you're having a little something sweet and you're feeling your joints, I just really try to substitute out fruit, like berries, more low sugar fruit. I think you're better off just trying to do that to have that as a different option. I've been avoiding gluten for a few years now, but I've read some sources to avoid other gluten-free grains as well. Is that recommended? Beans, legumes. Okay, we're moving on. I answered that question already. Is it possible to do the home allergy testing kits that are now being offered to flag allergies as opposed to doing elimination diet? It's actually a very good question. Might take me a few minutes to answer it though. So the question is, what about those food sensitivity tests? Can I just do that and not do an elimination diet? It sort of comes back to, darn, I really don't want to do an elimination diet. Isn't there a blood test? And the answer is not really. They're really asking the body two different things. The blood testing, is looking at just one pathway for how a food might be causing inflammation in the body. It's just one reaction. Food can cause, there's just so many ways food can affect the body that even if you're negative, if you pick something up and you're positive, if the test is positive, it's helpful and you take those foods out. But and actually a lot of times I do the tests. The one that I use is from KBMO. I do a KBMO IgG plus complement activation test, and it's helpful. Like if somebody's positive on that, okay, we'll take those foods out. Those foods are likely triggering systemic inflammation. The problem is that it's only one pathway, and so you have to also do an elimination diet because it won't pick up foods that are triggering digestive issues. So it won't pick up foods that are causing you to have reflux or chronic sinus drip or heartburn or diarrhea or constipation. Like it won't pick up any of that. And so you have to do an elimination diet to figure out foods that might be triggering gut microbiome issues for sure. The other thing is that it won't pick up, there's other inflammatory pathways that it's not going to pick up. And so you might be fine with tomatoes on that food, on that blood test, but when you do an elimination diet, you add back tomatoes and you have and your joints hurt the next day, or you can't walk, you get out of bed and your feet hurt getting out of bed the next day. And it's not picked up on that test. And the reason why is because there's just another pathway that we can't test. There are hundreds of pathways of chemicals that can be released. And so it's only asking one question where we need to ask like 20 questions. The elimination diet asks all the 20 questions of your body. The other thing is why we really do encourage people to do these elimination diets is because I call it the aha moment. We get to create an aha. Oh my God, I can't believe that's how I felt when I ate that food, right? So it's an aha. You sort of have this realization and you feel it. For you to like feel that you ate that, like the woman who just sent in that question about I eat sugar and the next day my joints hurt. You can't attest, might tell you that on paper, but experiencing that keeps you away from sugar. Okay, so I think there's something to be said about living the experience and seeing in your bones exactly what's happening. So that's food stuff. A couple of questions about gut, which is good because I really do want to talk about that. I've read so much on healing the gut, how to do this so that it lasts. Can it ever be able to eat sugar, dairy, meat again? I answered that already. Yes, is the answer. Probably not all the time, every day, the way you used to, but generally speaking, my goal is to get people back to being able to have a sort of whether we call it a cheat meal or just like a happy meal, once a week. But in terms of and the second question on gut was, is a leaky gut the main cause of arthritis? I said yes to that already. And so read so much on healing the gut, how to do it so that it lasts. Honestly, that is what my book and what our course is all about. We spend the whole time working on healing the gut, working with food, working with stress, and really helping you heal your gut. Depending on how bad it really depends on the point you're starting at. For people with mild osteoarthritis or mild arthritis, a few digestive issues, you might have no gut issues, by the way, and no digestive symptoms. Your gut is still not a problem if you have arthritis. Okay, you still need to, do some microbiome work. And so the way that I do that is I use herbal antimicrobials. I use herbal supplements, and this is where I use supplements. And we clean out the weeds. It's not a cleanse where you're in the bathroom with diarrhea. It's really just about it's treating the bad stuff that grows in the gut, bad bacteria and candida, yeast. The herbs we use can even clean out some parasites as well, some protozoa. Broad spectrum herbs clean out all that, like the bad stuff that's overgrowing. Your good bacteria can also overgrow as well and cause a problem. You can have too much of a good thing. And so this condition called dysbiosis, which is an imbalance in the microbiome, it could take a while to really get it fixed. And in some people, it's taken me and with them up to like 2 years. Some people like repeat stool tests and we're good. Like it's 9 months, a year, and the gut's looking pretty good. But I would say, generally speaking, it's at least a year to see really sustained changes that don't slip backwards in your microbiome. Steady improvement in the gut and seeing the gut improve, depending on the starting point, right? Worst starting point up to 2 years, better starting point less than a year, probably. It's not 3 months though. And usually what I tell people is we go through our arthritis program, you go through the book, you go through our 8-week course, or it's 9 weeks, you go through the course and we treat the gut, and then 6 months later, you're going to retreat the gut again because you're going to have to retreat it because, food and stress are the two biggest influencers on the gut microbiome. And so I think just accepting like there's a vigilance and an ongoing and a chronic nature of addressing your microbiome and needing to treat it and retreat it. If you're here, you have arthritis and inflammation, chances are we're going to take a little time to repair the gut. And I think that's in our quick fix kind of world and society that we live in, where we want a pill, we want to fix it right away. Technology, everything's bang, bang, bang. This is part of, this is the problem, is that this is hard. This is hard. This takes time and it's not easy. And that's why we've sort of developed these coaching programs to help you do it and to support you and be a cheerleader when 2 steps forward, there's a step back. Because not everybody can stay on a food plan, or not everybody, you're not going to be on the full elimination diet for a year. Okay. I didn't mean to suggest that. There's the original therapeutic plan, and probably in a couple months you can introduce things back again. But the work on the gut microbiome and the sustain, needing to retreat it and needing to support it, whether it's with probiotics or with something like glutamine powder, which is a leaky gut treatment. Like the ways that we're working on the gut, that's sustained over a long period of time. And we all fall off the wagon, and you go on vacation and you get a little flare, and over time you'll be more resilient and you won't flare when you go on vacation. But at first you will. And that's just what happens. And over time, the goal is to build resiliency. We have to finish what we start. You start the program and you keep it going and finish it and develop resiliency in your system so you can go out to dinner once a week and eat what you want. But you're not there yet, and it'll take some time to get there. Okay, so a couple of things about inflammation, and then I want to talk about supplements. So what's the best? Is chronic inflammation in one joint going to impact the entire body, including the brain? For example, is my arthritic chronically swollen knee going to have a systemic impact on my body? I love that question because I want you to reframe the way you thought about that. It's all connected, yes, but not the way you think. The inflammation that's coming from your body, that's coming from your abdomen. So in osteoarthritis, a lot of inflammation and oxidative stress comes from body fat, right? Metabolic syndrome, belly fat, being a little over fat and having this metabolic brown fat, we call it, in the gut, especially abdominal obesity, generates a lot of inflammation, a lot of oxidative stress. That inflammation is going to show up in the joints. So it'll cause your knee to be arthritic, or cause inflammation in the arthritic knee. And it will cause oxidative stress in the brain. Oxidative stress in the brain is actually one of the causes of cognitive impairment, memory, not remembering things, being a little off your game, headaches. Oxidative stress is a problem for the brain and inflammation, and it does cross over. So the same inflammation we're talking about that's coming from your gut, that's coming from your belly fat, that's ending up in your knee is also ending up in other joints and also ending up in your brain. So your knee is not doing it to your brain, but the underlying cause of your knee is also an underlying cause for other parts of your body. And so that's how I would explain that. Is chronic inflammation, I did that. How can muscle pain be alleviated? Muscle pain well, this is an interesting question and probably out of the scope of today, but how can muscle pain from scoliosis be alleviated? It's secondary to the stenosis. There's the pull on the muscles. The muscle pain is more severe for this person than their joint pain, than their stenosis pain. And I sort of know what you mean because I have this terrible arthritis in my shoulder, and my pain is from all the frozen muscles that are around it. And so that's a bit of an issue. So yes, you have this going on. But the muscle pain is you have chronic sort of triggering of the muscle because they're under a lot of tension. There's 2 things. Number one, you have to work on both fronts. So number one, you still have to do what I'm talking about make sure there's no inflammation, get the inflammation out of your diet, make sure your gut is healthy. But you might need some additional manual type things. And so trigger points, fascia work, physical therapy, like there's ways to try to release. We do trigger point injections at our office, and it helps a lot with things like that because those muscles go into spasm. So you might need some additional help for those poor muscles that are constantly being sort of tight and triggered. And the anti-inflammatory approach is going to help you too. Chronic hip bursitis due to scoliosis. sore wrists, my knees, everything's a problem now. So you're thinking of going on one of our regimens, what would I recommend for you? You're 69 years old and you have visceral body fat and you don't get enough exercise. Okay. So you already know lifestyle is important. And I understand, and I really think you would just do great, even though you might not have technically arthritis, although you might have said your sore wrists and knees. You should definitely join our arthritis challenge, which is starting in 20 days. Melissa, you told me the date. Where is that? You know me, I can never hold those things. February 14th. So part of what's going to happen after tonight is that you'll have the opportunity in the follow-up emails to just sign up for the arthritis challenge. That's our coaching program. It's with Melissa and me, and Melissa and I, Melissa and me, and we run this, and it follows the book, but it's really a great supportive way to start working on food, start working on stress, and work on repairing your gut. And this is good for anyone with inflammation. So bursitis, come on board, come join us. Just sore wrists, no official diagnosis of arthritis, come on board and join us. It's really to treat inflammation. Especially if you have any digestive symptoms, then you know your gut needs some work. This is rather broad, but recommendations for reducing inflammation, I just told you. So a question, it's a little off topic, but about primary immune deficiency disorder that's genetic. It can cause other issues. Can it be making inflammation in my myofascial pain syndrome? And so the answer is yes, because there is an immune connection there is a connection between the immune system and inflammation, like I said before. That being said, the work that we've been doing, and even my first book, The Immune System Recovery Plan, really should help the immune system work better. The microbiome is critical for the functioning of your immune system. So if you have an immune deficiency condition that's genetic, we're not 100% guaranteed to end up with our genetics. Our genetics is not 100% our destiny. So we can try to help improve that a little bit. You can, by really working on these things we've talked about. To reduce inflammation, you can still help your myofascial pain syndrome. But yeah, you are starting out a little handicapped. But so for you, some of these things we're talking about might be especially important. I have autoimmune hepatitis, my IgG is elevated. What can I do to reduce the inflammation? Everything we've been talking about, same thing. We talked about autoimmunity, no matter what kind of autoimmune disease you have. Thanks for the opportunity to ask questions. Diagnosed with mild OA and a very small labrum tear from a trauma sustained 3 years ago. This is good. I wanted to read this for everybody because it's a question about cortisone shots. And the specialist suggested cortisone injection, recurrent pain, achy episodes down. So it's really, really a problem. Is there any other way to heal besides using injections and surgery? I don't know. I'm not the best one to answer about the labrum tear. Sometimes surgery is needed. Sometimes they'll tell you can leave it alone. There are some what I would tell you to do, and I recommend this for any of you out there. There's a field of medicine called regenerative medicine, and they are physiatrists. They're non-surgical orthopedists. And if you're starting to go down this path to figure out what to do, that's surgical, non-surgical, and injections, before running to a cortisone shot, I would go to a regenerative medicine specialist. Sometimes they're in a sports spine and medicine specialty clinic. They do like something called PRP and stem cell injections. And sometimes PRP can help repair the labrum tear. The cortisone shot is not going to repair the labrum tear, but it'll help you with the pain. Cortisone shots are really a Band-Aid, and some people believe they're not even great to do like often at all, maybe once, and that they might actually, undermine the long-term healing. So before doing a cortisone shot, go see a regenerative medicine person. Their specialty is called physiatry, and they practice something called regenerative medicine, and you can probably Google that and find somebody near you. A few of you asked about labs, about your C-reactive protein and all this. I'm skipping that. We're over an hour in, and I want to get to talk about supplements a little bit because there were a lot of questions on that. And I'm going to tell you to go buy my book. I talk about all the labs, about arthritis, about knowing which ones you have, about what's high, what's not high. And so those are very personal questions about that. But yeah. And the kinds of tests we do. All the questions had to do with C-reactive protein. It's only one marker for inflammation. I mean, if it's high, then you do have to worry about having inflammatory arthritis, and we do want it to be low. So when it's elevated at all in any way, you want it, then there's a concern that there's inflammation in the body, and we work hard then to get it down. One of the things that I really do use to lower CRP, by the way, is fish oil. Fish oil is really great for lowering CRP, and curcumin, turmeric is also really good. Curcumin and turmeric is I'm using the word for the same thing. Turmeric is the name of the herb, and curcumin is the active ingredient. And so a question about osteoarthritis. Just started reading your book. I'm 72. Is it possible to reverse it? And the reason why she's diabetic and hypertension, again, the concern about the body fat, right, with osteoarthritis. And so both hands are painful. And so honestly, if you can't afford to enroll in the program, buy the book. And you're reading the book, sorry. Start with the food plan, because, and maybe, work on the sugar and the body fat. But the food plan, and that's the best place to start. But I want to say about the question, what I want to hone in on the question about reversing my osteoarthritis. Wear and tear in the joints is inevitable as we get older. So we're all going to have some wear and tear. But you can hold up an x-ray of one person's x-ray. The two x-rays look exactly the same. There's wear and tear in both these knees, for example, but one person has pain and the other one doesn't. And so pain is not inevitable. I think wear and tear probably is. And I really do believe that, so you can't really reverse osteoarthritis once it's started. So once you have the damage to the joints, you can't reverse that. But that doesn't mean that you're condemned to chronic pain, which brings me to the next batch of questions I just realized is about pain. And I think I answered a bunch of those, but a lot of people asked about non-pharmacological alternatives to help with joint pain. And really, all the questions really still come down to inflammation and oxidative stress. What I will say can help. There's a couple of herbs that are really good for pain. My combination usually is a combination of high dose fish oil. I mean, I believe in using fish oil and GLA, which is the other omega-6 that's really anti-inflammatory. So I go big. I go like 3 grams a day of EPA plus DHA, 500 milligrams a day of GLA, and I give people a lot of oils, a lot of fish oil to take every day. And I think that alone can really help with pain. Then I'll use herbal and I'll add to that. So curcumin, at least 1,000, 500 twice a day. You can go up to 500 3 times a day, but 1,000 minimum is sort of the studies to help with pain and inflammation. And the true pain herb is called boswellia. Boswellia is a true, it's frankincense is the name of the herb, and it helps with pain. And so there are definitely herbs to do, and there's herbs, and those are sort of like my go-tos, but you have to be doing all this also. And I think that was the point I wanted to make earlier. And so all of you who asked about your pain, there was a whole bunch of questions. I have pain, so topical, somebody was asking about Voltaren pain and what else I can do. And I think I've been going over that this whole time. One of the things you can try topically, which is really nice that I'm using a lot of, is CBD. Topical CBD is actually really helpful for pain. And then there's things like capsaicin cream, and there's so I think the capsaicin and the CBD are really the two things that I'll use topically a lot. And so pain and inflammation sort of go together. So a lot of you, and some of you that asked about pain, still in pain, what am I missing? Took your supplements and I'm still in pain. See, that's a good, And so for you who asked the question about you have spondylolisthesis, taking supplements, doing the food plan, still having pain, primary sort of, spine issues. The problem, I'm back to what else have you done, right? Did you look at the gut? Did you really work on your gut yet? And so going through all the steps in the program to really, so food is okay. And you know how I pointed out at the beginning that I'm not just going to substitute and give you like a pain herb and think that's going to fix everything. It's still about doing the whole, root cause of everything. Gut, like the gut microbiome. So I'm not sure if you worked on the gut when you said you took supplements, but that would be the next place that I would go. And then last but not least, I think now we're going to just move down to, I think I've answered everything. There were a few rheumatoid arthritis questions, but I think I answered that. Question about when can I stop my medication and only do functional medicine? It's a conversation for you with your doctor. So you're going to, get better. So once you feel better, my goal with functional medicine is get better, reduce your symptoms. You're here because even though you're on medication, you're not. You still have symptoms and you still have pain and you still have inflammation. So let's get you better. Let's get rid of the pain and inflammation. Then you go back to your doctor and you say, hey, I'm really feeling great. Can I taper off my medicine? And so that's sort of how, we do that. All right. And so somebody asked about fish oil for pain and not the arthritis supplement protocol. I think I'm going to stop here. I think I'm going to stop here because we're definitely over time, and I want to come back and just see where we are with now, and just see where we are. Thank you for everybody posting. I'm just looking at the post for a second. Yeah, generally speaking, so yeah. Questions about how long to do an elimination diet. I just saw that one. I want to say, before you start reintroducing food, in general, I would like you to feel better before you start reintroducing food. So it's really not about time. So sometimes, with a lot of people just doing it that aren't terribly inflamed. So the minimum time is 3 weeks. Let's put it that way. Minimum 3 weeks. But it could be 2 months. Because you're not really feeling better yet, and that we want to start working on the gut first. If you do an elimination diet, you might have to wait till you start feeling better, and that might mean, working on the gut. Oh boy, look at there's so many questions. You guys are going to have to come to the arthritis program. I'm going to share my screen and start showing you a few things now, okay? You might just have to come and sign up for Arthritis Challenge. That's really where you're going to get all those questions answered about which stool test is better. And geez, there's just too many things to talk about. So I'm going to show you. So here is, we just put this up. Excuse me. Drinking some water. So we just put this up. The actual date is, what'd you tell me, Melissa? Geez. February 14th, 20 days. It's actually, so in 20 days, we're starting the Arthritis Challenge. You can go on here and you can learn all about it. It's really a program that we're going to go through together. We're going to go through this program together. This is Melissa and I. We're going to go through the whole anti-inflammatory. It's a 10, we give 10 weeks because the end is all about moving. The last few weeks is all about getting you ready to go back into your life. So, moving into a maintenance program at the end is really important. And so what we did here in this website, you can go to my website, blumhealthmd, blumhealthmd.com. And it's all about what we're going to do in the program. And what I like here is I like all this. It's everything you're going to get. It's the 10-week course. a lot of classes, a lot of coaching. And then I want to talk to you for a second about the supplements, because people just ask which supplements are good, and I want to just share them with you. You don't need to do the supplements to be part of this program. If you live around the world or elsewhere, we're happy to help you get supplements or help guide you to getting supplements or using your supplements. But this is the sort of list. I sort of came here so you can just see these are the basic anti-arthritis and anti-inflammatory supplements that I like to use in the practice. When we're talking about, when we're talking about this whole idea of, how to use supplements to treat foundations, so the functional foundations of everything. So fish oil is a must, and GLA is a must. This is the omega-6 that is anti-inflammatory. The omega-3s are the fish oil that's anti-inflammatory. We have, this is a little confusing here. Sorry, we just put it up today, so I see we have to edit this a little. But there's one bottle of everything in this, and so that'll get all tweaked, because it doesn't. It's weird that it says it on some of them and not on the other. But just look at this for the purposes of understanding what's here. A good solid multi with a lot of extra antioxidants this is my way of getting you extra antioxidants into. You have to have just solid, cover the bases, but this multi also has a lot of extra antioxidants in it for the oxidative stress piece. Vitamin D is critical for the functioning of your immune system. Most of you have vitamin D. You don't have to get ours, but this is, you see here why I feel it's so important. Extra vitamin C for oxidative stress is really important. Good studies on osteoarthritis and vitamin C. Curcu Plus, that's a product that is curcumin and boswellia combined. One of the reasons I really like it. So it's good for pain and inflammation. And so those are the main things. So this column on the left are really just good basic arthritis supplements. And really, at the end of the day, most people in my practice are all taking, in general, a multivitamin D and fish oil. So in a way, it's almost your basics plus beefed up a little bit. And probably the fish oil dosing is more than what you would normally do in your everyday sort of, if you didn't have arthritis and you were just taking basics, not to treat inflammation and pain. On the right is really our gut. This is our basic program for the gut. Part of the program is mostly focused on both. It's focused on underlying general anti-inflammatory and support, and then it's healing the gut really aggressively. And so we use a protein shake that is anti-inflammatory and gut healing. There's probiotics. There's glutamine powder, which is for treating leaky gut. The gut cleanse box are where all my herbs are. So I custom made these packets that have all sorts of herbs in them to clean out the weeds from your garden. And it's 30-day gut cleanse. And so this is the more intense 30 days of gut treatment. And then for month 2, we still continue some gut treatment just with just mild doses of some herbs to continue the program. And so that's the way the supplements work. They're optional. You don't have to use ours. You can use your fish oil, but at least you see that we sort of lay this out for you so you can see what you would need. We have, that's today. And so, And so here you'll have the option to also see the exact course outline, what we're going to do week by week. So come over here and take a look. A lot of questions. This is for all of you who sent in a lot of personal questions that have a lot of detailed questions. I wish I could answer them all, but we definitely can answer them when we do the in the course, which we're starting soon. And so I know that there's a lot of raised hands and there's Q&As. And so, yeah, so there's some questions about testing, like functional medicine testing, and I'll throw in just a few last things before I wrap up. There's a question about stool testing and a question about Dutch testing. And so stool testing, I use both GI map and GI-FX, and I use two different stool tests. I'll alternate between, but I really do like doing stool testing to assess the microbiome. And for those of you who are working on, and I'm not going to get in the nuances of the different tests here. That's not the place for it. They're both good. And if you're not sure, just whichever one you can do, you can do. The point is that that's another thing to consider when you hit the wall. So a lot of you wrote in questions of, I'm doing this, I'm doing this, I'm doing this, and I hit a wall. Maybe it's time for testing. So maybe it is time to do a stool test. Maybe it's time to figure out what's going on. Maybe you have Lyme disease. We have to check you for Lyme. I don't know. And so if you do the whole arthritis program, and you go through them and you haven't made any progress at all with the food, the stress program, and the gut treatment, there's something else going on. And I would be looking for an infection. I would definitely be looking for Lyme. It's something I see all the time and I pick up all the time in the practice. And so, and maybe toxin load or some big exposures to something that's causing a lot of stress and oxidative stress in your body that's coming from something else. And so we might have to go looking for other things, and or to determine if your gut needs retreatment, and to decide if I've treated my gut enough. Am I done already with treating my gut? That's where a stool test can come in. So it can help us. It can help you decide if it's time to finish, if you're done or not with the gut treatment. And we've set it up so that anyone coming through our coaching programs online, that we can, like Melissa, can do one-on-one coaching and do a stool test for you. So we actually can provide that opportunity through Blum Center at the end or during the online course, the group program. So that's that test. The other test is the Dutch. I use it all the time. That test is for stress system, for adrenals, for figuring out, where you're at with your whole stress system and your hormones. I use it a lot. I don't really need to talk much about that here. It's really out of the context, but I will say that one of the ways that stress causes inflammation is chronic prolonged stress, that you're not balancing with good practices and lifestyle and relaxation practices in a way to mitigate that stress, how it comes into your body. You can end up with very low adrenals, like flatlined adrenal fatigue. Although my colleagues now, nobody likes to use the word adrenal fatigue anymore, but it's sort of low functioning adrenals, or it's really almost adrenal insufficiency, low cortisol output. And that cortisol is your natural anti-inflammatory. It is going to put out the fire. And so you need healthy adrenals to help you manage the inflammation in your body. It's another piece of the puzzle. And so I talk a lot about that in the book. And so we work on that too. And so there are tests for these things, and functional tests, we figured out a way to help do through our coaching programs online. Blood work, and there's other tests that can't be done unless you become a medical patient, which some of you have done over the years, which is fine as well. I'm not going to look at the questions anymore because I don't know if Melissa's been here answering people, but you will get just totally, there's way too many more questions than I can answer. I hope that those of you who came with questions actually got your answers as I answered other people, and that you came away with at least some help and some support and some ideas for what to do, because that was the goal. Inflammation is the number one underlying, trigger for all of our health issues, and leading an anti-inflammatory life, is really hard in our community, in our world. There's temptation everywhere. There's food temptation, our stressors. It's so easy to get lost in our stressors and be, it's very hard we have to be very vigilant to meditate every day, or listen to guided imagery, or journal, or do things. We have to be very vigilant to care for ourselves. This is where self-care comes in. You're all here because you want to learn what you can do to take care of yourself. And so self-care is the heart of everything. And so self-care includes what you're eating. It includes how you're taking care of your stress system and what you're choosing to do with your day, how you're scheduling yourself, emotions, regulating, it's all how you're taking care of yourself. How are you sleeping, protecting your sleep, and then doing what you need to do to repair your gut and to, there's also living a low toxin lifestyle. Toxins are a huge problem in autoimmunity. I go there last when it comes to the gut work, the arthritis and inflammatory arthritis people. I tend to move towards working on toxins after we finish doing the gut work. But, there's a lot of environmental, I think of stress as environmental. I think of food as environmental. I think of toxins as environmental. And all these things then damage our microbiome and our gut. And they all influence it and damage it. And so it's really this hypervigilance that we have to sort of take on to take care of ourselves and protect ourselves and stay healthy with so much going on with the environment that's coming into us, with so much changes in our food and our toxins in our life and the technology. And there's just so much. And we have to give ourselves permission, and we have to give ourselves a lot of compassion for how hard it is. So a lot of compassion for ourselves. This is not easy because it's a constant battle in a way. I mean, I don't want to use the word battle. It's a constant leaning in. It's a constant invitation to be mindful of these things. We have to, we have to be mindful of these things. And this is how we're going to get there. And so a lot of times we need cheerleaders and we need rah-rah and we need coaches and coaching support to help support us in our journey, because it's hard to do it alone. And it's hard to do it over a long time alone. So we need community, we need each other, and we need coaching. And so that's what I've tried to create all these years in my work life and in my professional and public life, is to create community. And thank you then for everyone that's here. A lot of you came live, and it's great to see you all, and I'm glad you're all here. I hope you've all been well and weathering what we've gone through together as a world in this pandemic. And I think we just have to really take a step back and really be mindful about taking care of ourselves. And the community support is really important. So as I close then, I invite you all to join us in our community and in our group program that's starting on the 14th. You're going to get plenty of opportunity to register, to look at, you'll get more information over the next days to come and join us. I think it's going to be really special this year. We actually have a whole new platform we moved it over to, so that all the material is going to be in one place. We're on a real course platform this year. And so we're very excited to offer that to you. And I hope to see you all there. And so take care. Thank you for joining me today, and be well.